perfecto. Aquí. Ahora sí.
Hello, everybody. I'm very happy because I'm here with Dr. Zermeno, German Zermeno, talking about his practice and a little bit about all his experience he has in natural medicine. So, Dr. Zermeno is a MD, medical doctor, specialist in anti-aging and functional medicine. He opened the American Institute of Natural Medicine in Irvine, California. After Dr. Zermeno practiced conventional medicine for 20 years, he found a better way. He became proficient in integrative medicine, focusing on treating the cause of disease, not just symptoms. Okay, hello.
Hello.
I have some questions for you
Sure.
about your practice. First question is, what is functional medicine?
So it's good that people know the difference because most people are used to the conventional medicine or the just allopathic practice, which is the regular doctor that you go to them and then you tell them your symptoms and they're going to give you a prescription. And most of the time they do not look for the cause of the problem. So they treat mostly the symptoms. I used to do that. So I practiced conventional medicine for 20 years. And so I know the whole thing is you don't have the time, number one, and number two, you're not trained to look for what is causing the problem.
Roots of the
problem. So for example, if you have hypertension, you find, oh, your blood pressure is elevated, you have hypertension. Okay, let me give you a medication for it. And that's it. But why? The question is why? Why do you have hypertension? Why do you have diabetes? Why do you have problems sleeping? Why do you have this? Why do you have that? This medicine is the medicine of why, not of what. I'm going to give you a drug for everything. But
I'll see you next
how
time.
are you going to correct? Yeah, well, how you can correct the problem if you don't know what is causing the problem? So let's say, for example, if you have hypertension and I give you a drug, but you never know that the reason why you have hypertension is because you're drinking 2 or 3 cups of coffee, you're drinking 2 cans of soda, you're stressed out all the time, you're drinking alcohol at night, maybe overweight, wine, a beer, something. You're not sleepy, you're stressed out. That's causing your blood pressure, but you don't remove that. I just give you the drug. You continue doing what you're doing. At the end, you're going to be on medication for life, and you're going to have more damage because you never corrected the problem. So functional medicine focus on why you have this. Okay, let's find out. Maybe it's the alcohol, maybe it's the cigarette, maybe it's that you're stressed out, and let's correct that to see if you don't need medication. The same thing with many things, diabetes, autoimmune diseases, all that. So in conventional medicine, they don't train you to look for that. They just tell you what medication to prescribe. In functional medicine, you see the body as a whole. You don't compartmentalize, or you don't break the body in pieces. By systems. So you don't have, oh, I'm cardiologist, I don't treat anything else other than your heart. What about your intestine? Oh, I'm a GI doctor, I don't care about your heart. But the body works together. It doesn't. The body doesn't work in pieces. So you have to have a full evaluation to see what it is. So in functional medicine, we are trained basically to look for what is causing your problem and try to correct the problem, mostly fixing what's broken. Is it like, are you having lack of hormones? Are you having a deficiency of nutrients? You have toxins? Well, what is causing the problem? So we don't need to use medication. Obviously, we do use medication, and that should be always the last resort.
Okay, perfect. I love that. Thank you. Okay, then why you switch from conventional medicine to functional medicine? Now I understand why, but
yeah. So I was practicing for conventional medicine for 20 years in a medical group. And again, there are so many problems. Number one is that you see so many patients. That's unfortunately the system. You have to see one patient every 15 minutes. So you don't really have time to see the patient. No. You're running around from one place to another one. And then all you do is just prescribe. the patient never gets better. So all you're doing is controlling their symptoms. You don't have the time to evaluate the patient, and you're only treating the symptoms with medication. At the end, the patient gets worse. So what you do, you send them to the specialist.
Mm-hmm.
The specialist is going to give them worse medication because they use a stronger, more toxic medication.
Yeah.
And at the end, the patient never gets better, and it gets worse and worse and worse. So I was frustrated trying to, well, why are people not getting better and they're just getting worse? So then I start looking for another alternative, and I start researching, and I found that anti-aging functional medicine works better. So integrative medicine means it's integrated, means conventional is integrated with holistic or functional medicine, and it turned out to be the best of
way
both.
to treat
The best way to find out what's going on, because you have both. You have conventional medicine that you can use medication when you need to. You have the opportunity to do some tests, and then holistic medicine. You have the best way of treating the patient with some nutrients, with some supplements, correcting the cause of the problem, fixing the hormones. So it's a much better way.
Okay, perfect. Yes. What is one of your favorite treatments and why?
What I see, the most beautiful treatment that I see is pretty much the hormone treatment. Almost everybody has a hormonal imbalance. And because of toxins that we have, because our diet, because the stress, whatever, we have a lot of hormonal imbalance. The hormones are essential for life. They're not luxury. People sometimes think, oh, the hormones are just luxury. You need them to stay healthy.
Yeah.
The hormones are the way the body communicates. So your body communicates with other organs through the hormones, and they stimulate the production of protein. They stimulate the production of many substances, production of energy. They help the brain function better. So the hormones are essential for life, and I have found that almost everyone is deficient on of hormones.
We're talking about female hormones,
Yeah.
male hormones. Yeah.
We're talking about female hormones. We're talking about male hormones. We're talking about thyroid hormones. We're talking about adrenal hormones. There are many, many different hormones. The ones that are most common are the female hormones, which when the woman gets reach menopause, she runs out of hormones.
Right.
So then she feels miserable. She feels almost like the time, similar to when they have in their period.
But all the time.
But all the time. So it's
Yeah,
like a never
horrible.
ending thing. So they feel miserable, depressed, tired, hot flashes, fatigue. They don't sleep. They're irritable.
Yeah.
So they in a constant
discomfort
the whole time.
Many
Men,
ways.
it's amazing to find out that men are all low on testosterone. It doesn't
Even
matter.
young people.
Even young people. It doesn't matter if you're 20 or you're 70. They all have low testosterone.
And what's the reason?
We don't know, but we think that could be toxins, lack of nutrients, electromagnetic radiation, stress, something maybe in the food, the water that is suppressing the production of testosterone. But every single patient
and how,
that I see,
how this affect them? Low testosterone.
It's awful. It's affecting because when in women, for example, they feel miserable. They have again all the symptoms of fatigue, depression. It affects your brain. You cannot think very clear. You feel lack of motivation. You're angry all the time. You're anxious. You're depressed. You don't sleep. You have hot flashes, fatigue. You have no sex drive. Okay. You don't get orgasm if your hormones are low. It give you body ache, make you gain weight. I mean, just name it.
Yeah.
So many different symptoms. So if you want to live like this, is really not a pleasant time, because women unfortunately think that menopause is gonna go away.
Right.
Menopause doesn't go away. They need to understand. Menopause doesn't go away. Some of the symptoms of menopause will go away. The hot flashes, sometimes the insomnia.
5 to 10 years, they
stabilize.
Yeah.
Takes few years and they stabilize. But the complications of menopause will not go away.
Right.
The symptoms will go away. The complications will not. What are the complications? Osteoporosis, women start losing bone, depression, anxiety, weight gain.
Okay.
They have higher risk of heart attacks, higher risk of stroke, higher risk of cancer. Also, because of the brain depends on hormones. They have now linked the connection between dementia and
Right.
lack of hormones. So we have seen that women,
Estrogen in this case.
yeah, women without hormones, they have tendency to develop many complications. Those are just the physical. The social aspect of not having hormones are very important too. They feel angry, irritable, tired, have no sex drive. So then eventually they
Divorce.
start having problems with their husband,
Yeah.
or they start having
Partner.
fights.
Yeah.
Just think about it. If you're tired, you're depressed, and you have no sex drive, and your husband wants sex, and you don't want to, start creating conflict in the marriage, and eventually it'll cause major problem.
Yes.
They end up, oh, you don't love me, you maybe you're cheating on me. At the end, they split. That could have been
And if
prevented.
the husband is also with low testosterone, then together.
That's a war. Just think about it.
That's a
Husband.
war.
Okay, so we can talk about now what are the consequences in men of not having hormones. They also feel tired. They feel irritable. There is a misconception there that testosterone will make you angry or irritable. Well, it's the opposite. When testosterone is low, is when you feel tired, irritable,
Right.
lack of motivation. This is very common. Men feel like very apathetic, lack of motivation. They don't have any drive. They have no sex drive. They have poor performance sexually. They gain weight. They don't sleep. It's kind of like the same as women.
Women.
They feel anxious, depressed, all that. Put them together, okay, and they kill each other. I mean, they
Yes.
get angry with each other. Eventually, they don't get along. There is no attraction anymore because there are no hormones. There is no
Right.
sex drive. There is no attraction. It's kind of like, okay, I'm done with you.
Right.
It's awful. So you could prevent so many problems with relationships, social